Hello, my name is Catherine Peterman. I live in Rochester, Minnesota, in the heartland of the United States, and I work at the Mayo Clinic as a chaplain and a researcher. I'm honored to be with you, and I thank those who invited me to do so. I'm going to take a few minutes to tell you what I noticed in the interactions and offer a few suggestions that you may want to incorporate into your own thinking and your care for patients. First of all, Adam's deep concern for Mary and her son, John, was very obvious to me from the beginning of the simulation. Adam has arranged the video connection for them to talk with him about some very difficult news and to discover what is most important to Mary in the midst of it. Of course, in situations like this, it's optimal to meet in person, but that wasn't possible because of COVID restrictions. Instead, Adam did what he could to create a sense of intimacy and caring. He sat close to Mary, and he made sure that John could hear him. He responded patiently to John's question about his mask, though no doubt he had been asked the same or similar questions many a time. In a nutshell, Adam does what he can to help Mary and John feel at ease and respected, and that is something we can all strive for in our interactions with patients and their loved ones. Then Adam breaks the hard news that the treatment Mary has been receiving is no longer effective. He is calm, he is clear and direct in his approach, and notably, he avoids medical jargon and terminology. This is to be admired greatly. And then Adam asks if the information he has conveyed has been understood. This is so important, for in my experience, patients and their loved ones don't fully hear or understand such news because of the huge emotional load it brings. While Adam does receive verification that John and Mary understand, in my view, he could have more certainty by asking them to tell him specifically what they have heard, and even by encouraging them to ask questions. Such conversations take time, but may save time in the long run. As a chaplain, I was also concerned about the feelings Mary and John displayed. They are both clearly shaken by the news and are deeply troubled. I would have chosen to invite them to talk about their feelings with the hope of helping them to find some company as they did so and perhaps some relief. Adam may not have had the time to do that, but hopefully he would ensure that someone on the team caring for Mary would revisit these things afterwards. Adam then moves to ask about what is most important to Mary. He uses a spiritual assessment tool that is short, but also gathers meaningful information, and both are important. I'm struck that he asks the question once, and then rather than take the answer at face value, he asks it again, inviting Mary to deepen her answer, and she does. It's so important to notice this and also to do it. We don't conduct a spiritual assessment just so we can check a box and say it's done, but we do it so we can get to know our patients and care for them better. I would even recommend asking the question a third time, perhaps after John is off the video call. I might say, Mary, is there anything else that's important to you that you haven't mentioned yet? And pause, give her time to reflect, see what happens. And then, just like a blood pressure is taken many times during a hospital stay, I would also recommend doing a spiritual assessment repeatedly for Mary, especially when symptoms change or worsen. In my experience, things may come to the surface with time, with her own reflection, and as her death approaches. It's so important to make use of the information gathered in any assessment, including a spiritual assessment. Mary has emphasized how important it is that John is cared for, and Adam has arranged an appropriate intervention to make that happen. What a relief that must be for Mary. Mary has also asked that she not be in pain or alone when she is dying. Adam did not directly respond to these concerns, but Mary seems at peace that Adam will see to her care. Hopefully, he will take an opportunity to address these issues again in later visits. This simulation illustrates for all of us that providing a spiritual assessment and following up with appropriate interventions is essential in the care of patients and their loved ones. In my experience, it is a deep privilege to know and care for others in this way. They benefit for sure, but so do I, and I believe you will too. As you move forward in your own work, you also may want to look back at the definition of spirituality that has been devised by the International Consensus Committee in Palliative Care. It's a long definition. I'm going to read it to you now, but my hope is that you'll take it apart in your own reading and reflection. The dynamic dimension of human life that relates to the way persons experience, express, and or seek meaning, purpose, and transcendence, and the way they connect to the moment, to self, to others, to nature, to the significant, and or the sacred. That is spirituality. So again, I would suggest that you take it bit by bit. You might want to ask, in what ways has your own spirituality been dynamic? How has it changed? How has it developed? That is so common among people that I have worked with. How do you connect to this moment? How do you connect to what is transcendent? How do you find meaning? I encourage you to take some time to go deeper with this definition for the simple reason that it will help you to know yourself better, but it will also help you to discover and respect the spirituality of your patients and ultimately take better care of them. Thank you for listening, and I wish you all the best as you go forward with your studies and with your career.
Spiritual nursing care interventions for end-of-life care during COVID-19 pandemic. Unit 3. Planning effective spiritual interventions. We will now present a short reflection on the simulation video you have just watched. So let's take a moment to reflect on the scenes we have just watched in this short simulation. The first part shows Adam, our nurse, conducting a family meeting with Mary and John. Adam's main role during this meeting is to complete the spiritual assessment. In order to complete this, Adam needs to be compassionate and phrase questions in a way that Mary and John understand what's being asked. So does the nurse demonstrate compassion here? So we see at the meeting that Adam has included those who are important in Mary's life, and this is clear by John's presence. As John was unable to attend the meeting in person due to COVID-19, Adam organised the meeting over video link. This was a new way of communication for both Mary and John. Adam reassures them that the video link is working by ensuring everyone can hear and see each other. Adam makes sure the meeting goes well without any outside disturbance. Initially, we see Mary and John appear visibly upset, having been apart from each other for so long. However, Mary is reassured that she can now see John on the screen. Mary is a little anxious at the start and asks if John can hear her, but Adam offers reassurance to both Mary and John that they can see and hear each other okay. And this was quite common during the pandemic for families who have never used virtual means of communication. Adam tries to reassure both Mary and John as best he can by using simple language in a non-intrusive way. We also notice that Adam gives Mary and John time to adjust to the meeting. He gives them time to listen to what's been asked and gives them time to answer the questions. We see Adam is keen to hear how John and Mary are feeling, and he acknowledges these feelings during the conversation. So let's consider how the patient and family interaction took place. Initially, John is shocked at the start of the meeting because he sees Adam is wearing a mask. However, Adam settles these fears by explaining how healthcare workers needed to wear masks during times of COVID to protect all the patients, including Mary and John accepts this. This was particularly important during the pandemic. Patients and families often found it very difficult to communicate with us, and the masks almost acted as a barrier to communication. But we have to remember, we can communicate in many different ways. We see Adam makes good eye contact with both Mary and John, and this encourages the patient and the family to communicate a little bit better, because they feel you are listening to them. We see Adam's compassion here as he is in the moment with Mary and John, and establishes a good rapport with them. Mary appears very comfortable with Adam as her support. She also comments they are looking after her very well, and that both the chaplain and the social worker visit her daily. In a compassionate way, Adam sits beside Mary, at the same level as her, and sitting down at eye level with the patient relaxes the patient so that he or she will communicate more openly. Adam creates a space of open communication. The room is quiet and nobody interrupts their meeting. There is no rush to finish the meeting. Adam gives Mary and John as much time as they need. Throughout the scene, Adam is able to offer Mary comfort when working through some of the questions he has. When Mary doesn't understand what's been asked, Adam rephrases the question so that Mary can understand it a little bit better. He uses a sympathetic approach, a kindness, to difficult questions regarding what's important to Mary in the final weeks to months of her life. Adam also involves both Mary and John through every aspect of the spiritual assessment. And we see this as Adam chats over and back to both Mary and John throughout the conversation.